The study started because there was a patient who was discharged on high-dose steroids and they didn't have proper education and they developed high blood sugar level. And so we thought that we're missing something in here, and so we started a program where we try to find patients who are at risk of developing high blood sugar to be referred to a community pharmacy, and the community pharmacy can monitor their blood sugar twice a week. And based on their levels, if it goes high enough, they'll be referred to their GP or their endocrinology team in the hospital. And that way we can catch him before any issues happen later on. In my perspective, it sounds like an amazing thing, but that's from a healthcare professional's perspective. It's an amazing program. Every patient who's starting on high-dose steroids should start on it. But I also wanted to see what patients' perspective is, because healthcare professionals are thinking one thing, but what is the patient thinking? And so we decided to do a qualitative research looking at barriers and enablers of patients joining these community services. And so we did semi-structured interviews with 24 patients to see what their thoughts are based on this program. And based on these interviews, we managed to find some data that hopefully can help us tailor these programs a little bit better for them. Most patients, when they have cancer, they're worried about everything that is happening with them. And when you recommend a program like this to them, most of them are very positive about it. They all want to join it. But there is a lot of barriers that are preventing them from joining it. So even though a lot of them agree and they had a positive thoughts about the program, especially when it's recommended by a healthcare professional that they trust and they know they've had a good relationship with. And even if they don't fully understand what these levels mean, they still are aware that because their healthcare professional has recommended it for them, that it's something that they should be doing. The problem is that not all patients are able to access these services. The program requires them to go to a community pharmacy, it may not be their own pharmacy, twice a week to get their blood sugar monitored. And so a lot of them thought that because they don't know which pharmacy they're going to, they don't know how far it's going to be, a lot of them could have other comorbidities related to their cancer treatment that is preventing them from going, such as fatigue. A few of them had seizures, so that they're not allowed to drive anymore. And so they're dependent on carers to take them to their appointments. Which leads them to feel like they're a bit of a burden to their carers, and therefore some of them may not agree to participate in the program because of all these things. And sometimes when we're explaining the program to the patient about the requirements, about everything, sometimes they misunderstand us. And so in my paper I found that maybe we need a better method to be able to pass this information to the patient, for the patient to be able to understand, as well as think about whether the patient's going to be able to access the program easily or not. Is there a lot of barriers for them and stuff like that? So these are some of the things that I managed to find, and it did highlight that patients who are independent, they're functioning well, they feel like they've got a lot of services around them, a lot of pharmacies around them, are more likely to join. But what happens to the other patients? How do we catch the other patients? How do we make our service more acceptable for other patient cohorts? And that's something that we just need to work on. Program is a big multidisciplinary team where it involves a lot of oncology, endocrinology, GPs, pharmacy. We're also getting diabetes educators involved to discuss what other options we can add to make this program even better. I did realize that coming to ISOPP that this is an international issue where a lot of sites are actually noticing that high-dose steroids are causing a lot of problem, and it's something that we really need to try to address. And so things like maybe adding other centers or district nursing, or giving a glucometer to patients for home monitoring, but it's something still in the working process.